Hello everyone! Today we're going to talk about a cancer that occurs in specific part of the gastrointestinal tract. We are talking about rectum cancer. The rectum and the colon make up of the large intestine. The rectum, however, is the last portion of the colon, the last 6 inches that connect the colon with the anus. Colon cancer and rectum cancer are usually referred to as colorectal cancer and are grouped together because they share the same characteristics and sometimes treated the same but not always. Our role today is to answer most of your questions regarding colorectal cancer. Today we have Dr. Kim, who is a leading doctor at Bucheon St Hospital. He is going to discuss with us everything about colorectal cancer from an experienced medical point of view. And before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Kim.
Hello.
Nice to meet you. Before we start, can you please introduce yourself to our viewers?
Sure. I am Kim Hyun Ho, and I work at the Catholic University of Korea Bucheon St. Hospital.
All right. Straight to the first question. So, Dr. Kim, what is colorectal cancer, and which part of the intestine can be called colorectal cancer?
Sure. The large intestine is between the small intestines and anus. It is about 150 centimeters and can be divided into colon and rectum. It is connected to the small intestines, appendix, ascending colon, descending colon, and S colon. The rectum is between the anus and the S colon. Depending on the location of the cancer tumor, it is called rectal or colon cancer as a whole. Malignant tumors tend to have the ability to encroach other organs and metastasize.
So this is a question frequently asked for all cancers. Does it have certain symptoms?
In terms of symptoms, generally speaking, one can experience sudden weight loss without seemingly any reasons for it. Tiredness, nausea. Also, bloody stools, constipation, diarrhea, and other changes in the excretion process.
Okay, so how about the prevalence of colorectal cancer?
As per 2018 data in Korea, 28,000 per 500,000 people get colorectal cancers. As per the entire population, about 11% are affected by it. When looking at it as a whole, it is right after stomach, thyroid, lung cancers in terms of frequency. For men, it is right after stomach and lung cancers. For women, it is right after breast and thyroid cancers. It is the third most common cancer.
So can you tell us a little bit about the causes or the usual causes of colorectal cancer?
According to studies, there are differences between country or region, but it is assumed environmental factors play a bigger factor than other causes. Age is a major detriment. After age 50, the risk escalates increasingly. 90% or more are diagnosed after age 50.
Is heredity can also be cause for colorectal cancer?
For colorectal cancers, about 80% are caused by non-determined factors, while about 5 to 15% are genetically related causes. Of these, they are family-related cancers. While a family with no history are about 6% at risk, while those with family history are higher at about 12%. If a family has 2 more affected, the risk goes up to about 35%. Also, if someone has colorectal cancer at 35, the risk goes up significantly for other family members. For the general population, we recommend an exam every 5 years after age 50. For people who have family members who are affected by colorectal cancer, it is recommended they start exams at age 40. Also, if family has it, the other members should start 10 years before the family member was diagnosed with cancer.
Dr. Kim, is there any relationship between nutrition and the risk of colorectal cancer?
So far, while there is no clear connection established, it is though there is a major link. High intake of animal products, lack of edible fibers, refined sugars are suspected to be factors. In terms of proteins, red meat and processed meats are known to be potential causes. Especially foods that decrease good bacterial flora on the colon is known to be harmful. Also, foods high in fiber are known to aid in the prevention of colorectal cancers. Fibers from fruits and vegetables are known to be more efficacious than fibers from whole grains. Alcoholic consumption is also known to be harmful. Calcium, selenium, folic acid, vitamins A, C, E, and carotene are known to be helpful in the prevention of colorectal cancer.
So we talked a lot about risk factors for colorectal cancer. Are there any other factors that you didn't mention?
Most colorectal cancers are known to begin from polyps, which can begin as a clump of cells that forms on the lining of the colon. Most begin as adenomatous polyps, and whether it evolves into cancer has a lot to do with its size. If we look at the clinical data so far, it takes about 5 to 10 years to turn malignant, depending on the size and condition. Villus adenomas tends to be more dangerous and prone to turning into cancer. Also, obesity is thought to play a factor in predisposing a person to colorectal cancer. Thus, food and lifestyle can play a role. Also, it can increase IBD and Crohn's disease risk and other bowel inflammatory diseases.
So Dr. Kim, what is a colon adenoma?
Colon adenomas are typically polyps. Most are harmless and are below 1.5 centimeters in diameter.
Going back to colorectal cancer, how do you diagnose this or how do you screen it?
According to our national health program, those age 50 and above, a checkup every year, and if test results point to the possibility of colorectal disease, we perform colonoscopy. Those without any symptoms, an exam every 1 or 2 years is recommended, or a colonoscopy every 5 years. There are many methods to perform a diagnosis for colorectal cancer. It can be done through examining the rectum and anal canal, also through colonoscopy. Colonoscopy can examine the entire colon and is the most effective and accurate. Aside from those, we can also use CT scans and other imaging techniques. However, these are most useful when detecting spread to other organs or the lymphatic systems.
What are the different stages for colorectal cancer?
The stage for colorectal cancer depends on whether the tumor stays within the lining or has spread outside. Generally, tumors limited to the lining and not spread to the lymph nodes is considered stage 1 or 2. When the lymph nodes are affected, it is stage 3. When distant metastasis has occurred, it is considered stage 4.
Okay, so we talked about the risk, we talked about the stages. How about the treatment for colorectal cancer?
Surgery is the main treatment. At the early stages, it is possible to do minimally invasive surgery. It can be supplemented with chemotherapy or radiation therapy. Removal surgery, including the lymph nodes, is most effective. Surgery can be expected to have great results and possibly result in a cure. Chemotherapy is used after surgery in order to decrease the reoccurrence rates, reduce the symptoms, and extend life expectancy. In rectal cancers, we combined radiation therapy with chemotherapy at times.
One last question. Is there a way to prevent colorectal cancer?
Even if there are no symptoms, it is important to have regular checkups to detect early. Also, regular exercise and healthy foods while avoiding alcohol is important. Also, intake lots of fibers. Avoid red meats and processed meats.
Thank you, Dr. Kim.
Thank you.
It was nice meeting you. Thank you. We learned many things about colorectal cancer and their different types. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.